What is cancer? Cancer is a disease where cells in your body grow out of control. Your body is made up of tiny building blocks called cells, like bricks in a house. These cells form everything in your body: your skin, muscles, bones, blood, and organs. Normally, cells grow, do their job, and die when they should. Cancer happens when some cells don't stop growing, don't die, and start spreading, forming lumps or invading other parts of the body. Cancer can be caused by a variety of factors, including genetic mutations, lifestyle choices like smoking and unhealthy diet, environmental exposures like radiation and certain chemicals, and chronic infections. Cancers are broadly classified into solid tumors like breast, lung, prostate, and blood cancers like leukemia and lymphoma. What happens to someone with cancer? Cancer can damage tissues or organs. It can spread, called metastasis, to other parts of the body. A person with cancer can become weaker, lose weight, experience pain, fall sick, and experience a variety of symptoms depending on the type of cancer. Some of the common symptoms of cancer include unusual lumps or swelling, unexplained weight loss, feeling very tired all the time, pain that doesn't go away, changes in the skin like a mole changing, changes in bathroom habits and bleeding when pooping or peeing, long-lasting cough or trouble breathing, and unexplained bleeding or bruising. These symptoms don't always mean cancer, but it's important to get checked by a doctor if they don't go away. What is metastasis? When cancer spreads to other parts of the body, it's called metastasis. When we say cancer is spreading, it means that cancer cells break away from where they first started and travel to other parts of the body. These cells move through the bloodstream to other organs or tissues. These spreading cancer cells don't destroy healthy cells directly like an infection would. Instead, they invade spaces, form tumors, and disrupt the normal function of the tissue or organ they've spread to. For example, cancer spreading to bones might weaken the bones, cause fractures, or lead to pain. Cancer in the lungs could block airways or make it harder to breathe. Once the cancer cells reach a new place or organ, they can start growing there and form new tumors. This process is called metastasis. The new tumors are still the same type of cancer as where they started. For example, if breast cancer spreads to the lungs, it's still breast cancer, not lung cancer. Doctors would call it metastatic breast cancer in the lungs. So metastasis or cancer spreading means cancer cells traveling to new parts of the body, growing there, and damaging those new areas by forming tumors and interfering with normal body functions. When you hear people or doctors talk about cancer, you will often hear common terms such as RBC, WBC, bone marrow. So what exactly are these? Let's find out. What is bone marrow? Inside your bones is a soft, spongy material called bone marrow. Bone marrow is like a factory that makes all your blood cells, including RBCs, WBCs, and platelets. In blood cancers like leukemia, the cancer starts in the bone marrow, which is why blood cell production gets affected. What is blood made of? Your blood is like your body's delivery system. It carries oxygen, fights infections, and helps stop bleeding. Blood is composed of both liquid and solid components. The liquid portion of blood is called plasma, and the solid components are red blood cells, white blood cells, and platelets. Red blood cells, or RBCs, carry oxygen from your lungs to the rest of your body. White blood cells, or WBCs, are part of your immune system and help fight infections like bacteria, viruses, and fungi. Platelets help stop bleeding by making clots. How is leukemia different from other cancers? There are many types of cancer, and not all of them work the same way. Leukemia is a blood cancer that starts in the bone marrow. The cancer cells are WBCs that have gone bad. They look like WBCs, but don't work like them. They don't fight infections well. They don't destroy healthy WBCs directly, but they take over the space in the bone marrow, blocking the production of good WBCs, RBCs, and platelets. So even though the number of WBCs is high, the immune system gets weaker because the WBCs are fake or non-working. It's like having a big army, but most of the soldiers don't know how to fight. That's why people with leukemia can get sick easily, have infections, feel weak, or bruise and bleed more often. How is cancer diagnosed? Doctors usually check for cancer using several methods. Blood tests often measure WBC and RBC counts. The normal WBC range is between 4,000 to 11,000 cells per microliter of blood. A sudden increase in WBC count can sometimes mean blood cancer like leukemia. But in leukemia, the WBCs are abnormal. They don't fight infections properly. These bad WBCs multiply too quickly and crowd out healthy cells in the blood. Imaging tests like X-rays, CT scans, MRIs, or PET scans help find tumors or abnormal growths inside the body. Biopsies are used to take small samples of tissue to check for cancer cells under a microscope. Other tests might include looking for tumor markers or checking for genetic changes in cells. If you found this video helpful, spread the knowledge and educate others.